Good morning, everyone. My name is Jeff Howard with the Community Relations Department here at Parkland. We'd like to welcome everyone today for our annual Coming Together for the Cure 2021 educational series. Just a quick reminder that we have 2 more sessions tomorrow and Friday, and we hope you'll be able to join us for both of those. The Spanish sessions start at 1 o'clock. Today's presentation is always one of our most popular topics every year: nutrition and breast cancer. We are extremely fortunate to have today's speaker, Nicole Hoff, a registered dietitian nutritionist that is board certified in oncology nutrition, to present today. Nicole has been at Parkland since 2014, working inside the hospital. If you have a question during the presentation, please type them into the chat. All questions will be answered at the end of the presentation, time permitting. First, we want to start off with a video from one of our community partners, and then we'll hear from Nicole.
The presentation.
This one.
Okay. guys for joining us today. We are going to be talking about nutrition in relation to breast cancer. So we're going to be discussing the importance of nutrition, especially for those with breast cancer, survivors of breast cancer. We will cover what a plant-based diet is and why that's recommended. We'll talk about the My Plate eating method, those that have difficulty eating during treatment and how to address those issues. We're also going to talk about common nutrition myths in relation to cancer, and we'll also discuss supplements. So why is nutrition so important? Eating right, especially when you have cancer or are going through treatment, is going to be really important to keep up your strength and energy. Oftentimes, if you are having a poor appetite, skipping meals, losing weight, then treatment might have to be held so you can recover, you can regain your functional status, or your treatment might need to be reduced. So good nutrition during treatment can lead to fewer complications, a better quality of life, and improved ability to tolerate your full cancer treatment. A plant-based diet is important because that can reduce your risk of other cancers forming and help you maintain a healthy weight. So let me start by saying why a plant-based diet is so important, especially for those with cancer. So plant foods have phytochemicals in them, and eating a wide variety of the plant foods provides different vitamins, minerals, fiber, and these phytochemicals can actually help protect your body from cancer cells from forming. So free radicals are responsible for cell damage and the formation of cancer cells. And antioxidants and phytochemicals found in these plant foods can help neutralize those free radicals to help prevent the cell damage. So that's why we talk so much about and emphasize following a plant-based diet, especially in cancer. So a plant-based diet just means that more than half of your plate should be plant foods. So this is going to be, of course, fruits, vegetables. It's also going to be quinoa, brown rice, lentils, oats, nuts. All of these are considered plant-based foods that offer these benefits. Animal products like meat, dairy, eggs, they can still be enjoyed just in smaller amounts. Following this diet is also not only going to reduce your risk of cancer, but other comorbidities such as heart disease, diabetes, and stroke. So the recommendation for plant-based foods, your fruits and vegetables, is going to be a serving of 5 per day, a combination of both fruits and vegetables. So this recommendation came from a large study called the Women's Healthy Eating and Living, which was actually a study of people with breast cancer. And it showed that there was a 50% increase in survival rate for those who consumed at least 5 servings of a combination of fruits and vegetables each day, along with 30 minutes of physical activity 5 to 6 days a week. So this study shows us not only the importance of healthy eating, but trying to stay physically active. A lot of these plant foods, especially vegetables, are low calories. Fruits and vegetables are high in fiber, which is really important because fiber is what's going to help you stay full, to help you avoid overeating and maintain a healthy weight. And we'll talk a little bit about how a lot of cancers, including breast, are strongly associated with being overweight. And so following this healthy eating plan will help you maintain a healthy weight. When you're planning your meals and you're trying to include fruits and vegetables into your eating, try to include a variety of different colors. So the color of the fruit and vegetable tells you what the main nutrients are, and each of these nutrients are going to offer a different benefit when it comes to cancer protection. So you see on this slide, if you're looking at your green vegetables, you're going to be getting a lot of iron, calcium, lutein, magnesium, which are all really important. And then if you look at your orange and your yellow fruits and vegetables, those are going to provide different nutrients like potassium, vitamin C, vitamin A. So if you were to be eating your vegetables and just eating like a small side salad every lunch and dinner, you're going to be missing out on a lot of other nutrients that are also important. So really try to get a variety in your eating. So now we can shift over to animal protein sources. So there is a lot of research that shows us that eating large amounts of red meat are associated with higher risks of cancer. So things like beef, pork, lamb, you can still have them, but they should be in smaller amounts. So try to only have them about 3 times per week, and be really careful with your serving size. So the serving size for meat is typically going to be about the size of a deck of cards. Processed meat is strongly correlated to cancer, especially colorectal cancer. So things like bacon, sausage, lunch meat, hot dogs, beef jerky, it's actually recommended to avoid these. If you are going to have them only in very small portions. These foods, the processed meats, are also really high in saturated fat, high in sodium, which puts you more at risk for heart disease, diabetes, or if you already have those conditions, avoiding these can help manage them. So good options for animal protein sources are going to be fish and chicken, chicken with the skin removed. So try to include fish at least 2 times a week, because there are a lot of great health benefits to eating fish. And then just take the chicken off of the skin, because that's where a lot of the fat is going to be. Non-animal protein sources are also really, really good options. So soy, beans, lentils, quinoa, also great options for your protein. So the plate method is just a really good, easy demonstration to show you what foods to include in your eating and in what serving sizes. So here we can start with your drink. So you see here they have a glass of milk. So for your dairy, milk, yogurt, cheese, you want to do a reduced fat, so like a 1% milk or a fat-free milk, reduced fat cheese, fat-free dairy. And it is important to get your dairy in, especially for the calcium and the vitamin D. Other drinks that have a lot of sugar, Gatorade, sweet tea, soda, aren't really recommended just because they do have a lot of calories, and that can add up over time and lead to weight gain. So even just 1 can of Coke has 10 teaspoons of sugar, and even a cup of juice has 6 teaspoons of sugar. And although it is natural sugar, which is better, it is still a lot of sugar. So you see here that they have half of their plate non-starchy vegetables, which we talked about earlier. So having half of your plate vegetables, if you do that with your lunch and dinner, that's an easy way to include and hit your goal of 5 servings a day for your fruits and vegetables. You can include fruit with your meal. You can have it as a snack in between your meals. So if you look at the bottom left, it has your starches. So this is also a good place to try to include some plant-based foods. You can do brown rice, quinoa, beans. Also some vegetables fall under this category, like potatoes, corn, peas. This is also going to be like cereal, crackers, chips. So when you're eating these, although they are beneficial to you, you still want to eat them in the right amount because they do have extra calories in them. So try to limit to just 1/4 of your plate or half a cup at a time. As you see here, the meat is only taking up 1/4 of their plate. So protein is important. It's especially important for your muscles. Again, it does have the saturated fat in it, and so we just don't want to go overboard on the portion sizes. Now, whenever you're cooking, it's okay to include some fats like oils into your cooking. You just want to only use maybe 2 tablespoons at a time. Olive oil is a really great option. Canola and avocado actually have some heart-healthy benefits. But try to avoid deep frying your food. That's just going to have a lot of extra fat in it, a lot of extra calories. You can cook in the oven, you can saute on a skillet, do a little bit of grilling, but just avoid the fried foods. So this is just a good visual to show a practical example of what it looks like to include these food groups in your eating and in the right serving sizes. And I like this visual too because it shows you, for the most part, you can have foods that you enjoy eating. It's really, really about the serving sizes. So if you like macaroni and cheese or spaghetti, that's fine to eat. Just make sure that you're only having half a cup at a time. Make sure it's only taking up a quarter of your plate. Maybe you try to do the whole grain pasta to get a little bit of the extra fiber. And you can see too on their vegetables, they're trying to include different colors of vegetables, mixed vegetables, a salad, it looks like with pico de gallo on it, a little bit of guacamole. So this is just to show a practical example of how the plate method works. And we can even try to include these vegetables and plant-based foods into our breakfast to help us reach that goal of 5 servings per day. So here we have an omelet, and they included onion, bell pepper, mushrooms, and spinach. Also a great thing to do with quiches. You can sneak vegetables into your quiche. For their oatmeal, they have fruit, of course. They also included almonds, so those nuts, which are the plant-based foods. Breakfast tacos, they had with onions and bell peppers, black beans, tomato, and cilantro. And a smoothie is a great way to get in that fruit first thing in the day. And some people will even add spinach or kale to their smoothies, and it really doesn't change the taste of it. One thing a lot of people, especially my breast cancer patients, ask about is juicing. So I do want to just touch on that. It is much better to have the whole fruit and not just the juice from the fruit. So juicing is going to be, it does give you the vitamins, that the fruit has, but it doesn't have the fiber. And so you can have the juice without the fiber and still be really, really hungry, versus the smoothie is going to have all of the fiber in there, which will help keep you full until your next meal or snack. So what if you have trouble eating? So everything that we've talked about so far is really great. If you have a good appetite, you're not having trouble, you're not skipping meals, or you find yourself eating smaller portions, you should try to eat that way. But sometimes your treatment can cause side effects that make it difficult for you to maintain good nutrition. Side effects differ depending on what type of chemotherapy you're on, and some might not have any side effects in relation to their eating. But it can happen where you're having unintentional weight loss, you're just not hungry, maybe you have problems with nausea or vomiting or diarrhea. Sometimes food can start tasting metallic to you, and all of these things just lead to having trouble eating. So if that's you, ask your provider for a dietitian referral. We're happy to give you individualized ways to help improve your nutrition and improve your eating. So if this is you, we don't recommend focusing so much on getting all of your fruits and your vegetables in. Like we talked about earlier, if you're not eating well and you're losing weight, it can cause you to become really weak, and then your doctor might not be able to give you your next treatment as planned. So in this case, we just want to help you get those calories in however you need to. So if you haven't eaten all day long and the only thing that sounds good to you is like ice cream and French fries, then probably we would say go ahead and eat that because you actually really need the calories. So a dietitian can help you cope with that and give you ways to help meet your calorie needs so that you can get through your treatment and have a better quality of life. One thing we might recommend in this case is oral nutrition supplements or protein shakes. So there's a lot of different ones that you can buy in the store. So we can help guide you on what one is good for you. So they vary in the calories that they have and the protein that they have, also the sugar content. So if you have diabetes or maybe you're receiving steroids for part of your treatment, then we can help you find one that is appropriate and lower in sugar. Another great option is actually just making your own protein shakes at home. So we can give you recipes. We have lots of different recipes so that you can find one that you like, whether you like chocolate or peanut butter or mint, cherry cheesecake, pumpkin. And there's lots of different options. This can be good if you're kind of tired of the same chocolate, strawberry, vanilla protein shakes that you buy at the store, or sometimes those at the store can get really expensive, and so this can be a more affordable way. And actually, a lot of the recipes that we have offer even more calories and protein than the ones that you find at the store. So I picked one just to show today, a raspberry protein shake, and this one has 440 calories, which I think the last slide, the highest calorie one was 360. So not only is this one going to be more affordable, but also higher in calories. So if you ask for a dietitian referral, this is definitely something that we can review with you. So now let's talk about some nutrition myths in relation to cancer. So myth number one, sugar feeds cancer. This is by far the most common thing that I hear from my patients. There's a lot of misinformation on the internet and the media about this. So we know a few things about sugar and cancer. So the first thing is that cancer, all types of cancer, including breast, are strongly linked to being overweight. And eating foods or drinking beverages that have a lot of sugar can lead you to become overweight. So that's one thing that we know, and why we recommend, in general, limiting sugar, things that have a lot of sugar. And it's not that they need to be avoided completely, we just want to be careful with those things. Another thing that we know for sure is that sugar, which is actually glucose, is the primary source of fuel for our body. So it's going to feed all of the cells in your body. It can't tell whether it's cancerous or not. But for example, it's the primary source of energy for your brain. So if you were to cut sugar out altogether, actually what's going to happen is your body is going to have to take, like from your muscles, start breaking down the protein from your muscle to make it into sugar to feed the cells in your body. And that can, again, lead to protein calorie malnutrition. And really, sugar is in a lot of things. So not just when you think of like junk food or sweets, but it's even in fruit and some vegetables and a lot of the plant-based foods, those starches that we're recommending that you eat because it has so many great benefits. So not that you need to avoid sugar completely, but just be careful with it. Another myth or question that we get with breast cancer is that breast cancers should avoid soy. So again, this is not true. There's been large research studies in places like Asia where they consume a lot of soy, and it hasn't shown that it affects their anti-estrogen medication, that it increases their risk of recurrence. So it is safe to have soy in moderate amounts. So 1 to 2 servings a day is fine to have. Soy foods like edamames, soy milk, tofu, these are also really good sources of fiber, selenium, and calcium. So there are some benefits as well to eating some soy foods. So myth number 3, flaxseed should be avoided. Flaxseed actually has a lot of benefits to it. It is high in omega-3 fatty acids. So talking again about these free radicals and how these plant foods are beneficial to us, omega-3 fatty acids help decrease inflammation, and inflammation actually increases risk of free radicals forming these cancer cells. So it's actually really beneficial to try to include flaxseed in your eating. Not only that, it also has protein, fiber, vitamins, and minerals. So how I try to include flaxseed in my eating is by just going ahead and buying a bag that's already ground and keeping it in my refrigerator, and then I'll add a couple tablespoons to like oatmeal, yogurt, soups, smoothies, and it doesn't change the overall taste of what you're eating, but it does provide great benefits. So this one we definitely get pretty often. So the next myth is that pesticides cause cancer and you should eat organic. So you definitely can eat organic. It's obviously not a bad thing. So if that's what you want to do, totally fine. It can become more expensive. And the most important thing is just that you're eating your fruits and vegetables. There haven't been any studies that show that people who eat organic foods have better health outcomes than those that eat non-organic. So don't feel like you need to eat organic if it's not in your budget or if it's just not something you want to do. It's totally okay if you eat non-organic, just eat those fruits and vegetables. Along the same lines, people have questions about GMOs. So current data can't confirm whether or not GMOs increase cancer risk, but consuming a diet rich in fruits and vegetables and whole grains outweighs any GMO health concerns when it comes to cancer. So what we know for sure is that it's very beneficial to be eating these plant-based foods, and that is what's most important, especially when you have cancer. So let's shift gears to supplements. Especially my breast cancer patients have a lot of questions about supplements, especially herbal supplements. These aren't regulated the same way that medications are. We don't know how herbal supplements might affect chemotherapy. There's also not a lot of research to back up the claims that herbal supplement manufacturers are making. So we actually don't recommend herbal supplements. They do not reduce the risk of cancer. They don't reduce the risk of recurrence. As far as vitamins and minerals go, it's much better to get vitamins that you need from your food. So if you are eating the way that we mentioned earlier with the plate method, you're eating your fruits and vegetables, you're getting a variety of colors in your fruits and vegetables, then you actually should be getting most of the vitamins that you need from your food. If you have a poor appetite and you're not eating well, or maybe the doctor draws your labs and sees that you're low in iron, calcium, vitamin D, then we will recommend a supplement just to get you back up to normal levels. But taking supplements to get higher than the recommended level is not recommended. So I wanted to show some resources that you could find other information about cancer and nutrition. I would invite you all to check out these resources. They have lots of different recipes to include the plant-based eating, snack recipes, breakfast, lunch, dinner. If you're having a poor appetite, taste changes, things like that. There's a lot of resources out there for you. And of course, ask your doctor for a dietitian referral if you want one-on-one counseling or having more questions about nutrition or problem eating with unintentional weight loss. So now I will open it up to questions.
Thank you, Nicole. We do have some questions that have come up, and so let's start off with, has there been any research done to determine if certain foods will lead to or enhance the chances of getting breast cancer?
That's a good question. So what we know and what there is a lot of research about is that being overweight is strongly linked to breast cancer. So it's important that you're eating healthy just to get to a normal weight. So it's not that one specific food can lead to breast cancer. There's research about red meat, eating in large amounts, processed meats, which can increase the risk of colorectal cancer, which is important to remember that if you have breast cancer, you are still at risk of getting other cancers, or if you are done with your treatment with breast cancer, that you can get a reoccurrence. So important to just eat healthy and get to a healthy weight and stay physically active.
Okay, so I know you talked about the danger of sugary drinks. Should patients avoid alcohol?
That's a great question. There is a lot of research on alcohol leading to a lot of different cancers. Especially whenever you're getting chemotherapy, you want to focus on drinks that are going to bring you hydration. Of course, water is the best thing. If you are going to drink alcohol, talk to your doctor. We don't recommend drinking more than 1 drink a day for women if you're going to drink 2 drinks a day for men. But of course, it's best just to abstain from alcohol.
Here's a great question. Is a protein shake or a smoothie considered a meal replacement, or can it be consumed with a small meal?
That's a really great question. So it just depends what your goal is and what you're adding to your smoothie. So if you are maybe someone that is a little bit overweight and is wanting to lose weight, a smoothie is great for a meal replacement. If you are someone that doesn't really have an appetite, the smoothie would be used like in addition to your meal. We still want you trying to eat solid foods, but you could do that as a snack in between your meals. Depending on what you're adding to the smoothie, how many calories it is, you could also have a snack with it, maybe a granola bar, something small. So a dietitian can help review your calorie needs, what you're adding to the smoothie, and give you better guidance on how to eat with it.
Okay, we know we love our chicken. And so is there ways that we can make eating chicken more healthy?
Yeah. So I've actually been using an air fryer a lot lately, which is great. So I have a lot of patients that love especially fried chicken, and they make it a family tradition, maybe to do fried chickens on Sundays. So the air fryer is a great way. You can put your breadcrumbs around it, and then you actually just have to spray it with cooking spray and put it in the air fryer. So you're adding very little fat. You can get a cooking spray that has olive oil, and so it actually has some heart-healthy benefits, and then avoid the deep fried things. Again, you just have to be careful with the skin. The skin is what has a lot of the saturated fat in it.
How about white meat versus dark meat?
That's a good question. I think the white meat is going to be a little bit less fatty, but either one, it definitely is better than eating the red meat or the processed meat.
Okay, is body weight a risk for breast cancer?
It definitely is. There are tons of studies that show that being overweight is a risk factor for breast cancer. So depending on where you're at, if you're wanting to lose weight, it is typically safe to do so during treatment or when you're done with treatment. But you want to be really careful. Only lose 1 to 2 pounds a week. We don't recommend fad diets where you're cutting out food groups altogether, you're losing weight really quickly. A lot of times when you're losing weight quickly like that, it's actually coming from your muscle, which can lead to malnutrition. So a dietitian can help you. It is okay for you to lose weight if you're not having trouble with eating poor appetite.
I know you talked a little bit about fiber in your diet. Could you expand a little bit about that and how it helps with the risk of cancer?
Yeah, so fiber has those phytochemicals in it, like we talked about, that can help protect your cells from turning into cancer cells, especially for if you're wanting to lose weight, if that's appropriate for you. Including fiber can help you stay full for longer so that you're not overeating at your meals. So that's another reason that we emphasize the fruits and the vegetables. They're high in fiber. If you're having things like rice, pasta, bread, trying to do the whole wheat, the brown rice, because those are going to have more fiber in them, more nutrients, and help you stay full.
Okay, I think we have time for one more question. Are there certain foods that will help with nausea after treatment?
That's a great question. So ginger has been shown to help with nausea. Trying ginger tea or just chewing on ginger. Also, hot foods can make nausea worse. So you might want to try to do a cold food, maybe a sandwich, some yogurt, or even room temperature foods are okay to have. Also, keep in mind that you don't want to sit in front of a big meal when you're nauseous. So eating just smaller portions throughout the day can help. If you're not eating at all, actually that underlying hunger can make the nausea worse. And so trying to eat just something small whenever you're feeling nauseous is helpful. And stay out of the kitchen. See if there's other people that can help you cook. Maybe you go sit outside or go to your room, but those smells of the hot foods cooking can definitely make the nausea worse.
All great advice. Well, this concludes today's presentation. We want to thank Nicole for joining us today and providing this valuable information on such an important topic. Don't forget that later today we'll be hosting our Spanish series starting at 1 p.m. And then tomorrow, October the 7th, for our next English presentation starting at 11. Just out in the community, Parkland is partnering with Salem Institutional Baptist Church this Saturday for a community health event. They're going to have flu shots, medical screenings, and a lot more. If you're interested, the church is located at 3918 Crozier Street in sunny South Dallas. Thank you, everyone, for joining us today.